Welcome to the quick guide of InsuPen Pro. Let's take a look at the different parts of the pen. This is the pen cap, which protects the pen, the cartridge holder, the pen body, which has a plunger rod, a dose window with large clearly marked digits, and easy to rotate dose knob, and a flat smooth injection button. Your InsuPen Pro starter kit comes with a pouch, InsuPen Pro device, user guide, warranty card, pen needles, and stickers to help differentiate the type of insulin that you are taking. Get all your supplies ready. Step 1. Take the InsuPen Pro out of the pouch and pull off the pen cap. Select the sticker according to the type of insulin. Peel off the sticker and paste the sticker onto the cartridge holder of the InsuPen Pro device. Step 2. Detach the cartridge holder by twisting and pulling gently away from the pen until it clicks. Step 3. Reset the plunger rod by gripping the pen body in one hand and gently push back the plunger rod with the other hand into the pen body. Before inserting a new cartridge, ensure that the plunger rod is fully pushed back. Step 4. Checking the cartridge. Remove the cartridge from the pack and check the label on the cartridge to ensure that you have the right type of insulin as prescribed and it has not expired. Also check that the cartridge is not cracked nor broken. Wait till the cartridge comes to room temperature before using it. Based on appearance, there are two types of insulin: clear insulin and cloudy insulin. Clear insulin need not be mixed. Cloudy insulin must be mixed before each injection as follows. Step 5. Mix cloudy insulin. Roll the cartridge between your palms 10 times in a horizontal position. Then hold the cartridge upright in your hand and move it up and down at least 10 times by flexing your arm so that the glass bead moves from one end of the cartridge to the other. Check to ensure that the insulin is uniformly white and cloudy. If not, repeat step 5 until the insulin looks uniformly white and cloudy. Step 6. Insert the cartridge. Insert the cartridge into the cartridge holder with the metal end first. Step 7. Fix the pen body. Twist the pen body back into the cartridge holder until it locks properly with a click. Step 8. Attaching a new needle. Take a new pen needle and remove the protective seal from the outer needle cap. Do not attempt to pull out the needle by hand. Screw the needle assembly firmly onto the cartridge holder. To prevent the needle from bending or falling off, keep it firm and straight while attaching. Remove the outer needle cap and save it for later use. Carefully pull off the inner needle cap and throw it away. A droplet of insulin may be seen at the needle tip. Step 9. Priming. Priming of InsuPen Pro must be done before each injection to ensure that there are no air bubbles in the cartridge and InsuPen Pro is ready to administer a dose. Turn the dose knob until you see the number 2 in the dose window. Step 10. Removal of air bubbles. Hold InsuPen Pro with the needle end pointing straight up. Tap the cartridge holder gently with your finger to raise any air bubbles to the top of the insulin cartridge. There may be a few small air bubbles still seen. With the needle pointing upwards, press the dose button in until it stops, and the dose window shows 0. You should notice 2 to 3 drops of insulin coming out of the needle tip. This indicates that priming is complete. If no insulin comes out of the needle, repeat the step up to a maximum of 5 times until 2 to 3 drops of insulin are visible at the tip. Your InsuPen Pro is now ready to use. Step 11. Setting the dose. To set the dose, turn the dose knob to set the required dosage as prescribed by your doctor. Doses with even numbers are indicated as digits, and doses with odd numbers are indicated by a short line between the digits. If the number set is higher than your desired dose, then turn the knob to a lower number until the correct dose is set. Please note, after repeated injections, If the injection button stops halfway and 0 is not indicated, do not try to force the injection button down. This means that the cartridge does not have enough insulin left. In such a scenario, replace the exhausted cartridge with a new one and inject any balanced dose. To administer your injection, select and inspect your injection sites. The preferred areas to inject are your abdomen, thighs and buttocks. The back of your arms may also be used. Step 12. Injecting the dose. Hold the pen needle at 90 degrees to the skin surface. Press the injection button and hold the needle in for 10 seconds to prevent leakage. Once the needle has entered the skin surface, do not change the angle of Insupen Pro because it can cause the needle to break or get stuck in the skin. Remove the needle from your skin. Step 13. Remove and dispose the needle. Carefully place the outer needle cap over the needle. A used needle should not be left attached to the pen. This is to prevent the entry of air or other contaminants into the cartridge, or leakage of insulin from the cartridge, which can affect the accuracy of subsequent doses. Unscrew the needle cap and dispose of it safely. Step 14. Storing Insupen Pro. To close the pen, align and press gently to secure the pen cap to the pen body. Do not remove the cartridge from the cartridge holder until the cartridge becomes empty. Store your Insupen Pro for next use in the pen pouch at room temperature. Remember to always use a new pen needle with every injection. During repeat usage, please follow all the procedures explained earlier except the inserting of the insulin cartridge. That is, pull out the pen cap, mix cloudy insulin, fix the needle, prime your pen for injection, select your dose, inject, discard the needle and store your pen safely at room temperature. Since insulin needs to be taken regularly, injecting at the same place can cause extra fat deposits, a medical condition known as lipohypertrophy. To avoid this, you must consistently rotate your injection sites around the chosen area of your body, as well as around different parts of your body. Insupen Pro is a reusable insulin pen that can deliver insulin from 1 to 60 units of insulin in one injection. For more than 60 units, you will need 2 or more injections. The scale on the cartridge holder is only an indicator of the amount of insulin left in the cartridge. Insupen Pro is only to be used with Biocon pre-filled cartridges as prescribed by your healthcare professional. Thank you for your attention. Please read the user manual if you have any doubts or consult your doctor.